Hello, welcome to this medication short where we're talking about the medication Droperidol, the first line med that we're going to be giving behaviorally combative patients. This will be prior to Versed or ketamine. It's going to be a 5 milligram IM injection, so that'll be 2 vials drawn up, so it'll be 2 mLs, 5 milligram IM injection. It's going to take some time to start working because it is an IM injection, so 10 to 30 minutes or so. So get that on board as soon as you can safely do so. Some potential side effects are going to be sedation, muscle stiffness, restlessness, tremors, involuntary movements, and potentially a prolonged QT syndrome or prolonging the QT segment. Some contraindications are going to be if they're prescribed some antiarrhythmics like amiodarone or sotalol, as well as if they're prescribed fluoroquinolones or some common antibiotics like Cipra or Levaquin, as well as intentional or unintentional large med overdoses. If you're able to discern what they did take, make sure you loop med control in because that might be relevant to their care, as well as, again, history of prolonged QT syndrome. And what that is getting at is the beginning of that QRS complex to the beginning of that T wave. That is your QT segment. And as that becomes prolonged, that can potentially deteriorate into a ventricular rhythm, which would be deadly. And so here we just showed torsades, which is going to bring you into clinically a different scenario. But it's just something to keep in mind, especially if someone has a known history of a prolonged QT segment or they're on other medications that might prolong that. This could further complicate that as well. It's not necessarily going to guarantee that will happen, and most likely it won't, but it's just something to keep in mind. Anyway, that's Droperidol. If you guys have any questions, just reach out. Thanks.